Good day, class. So today we will try to cover the first and second group under your Baltimore's classification, which is your DNA viruses. In this video lecture, the references will be coming from your Mahon and Baylis and Scott. If you have some questions and or clarifications, please don't hesitate to beat me up so I can clarify all the gray areas under your virology. So let's start with your Baltimore classification group number 1. So your Baltimore classification group number 1 is divided into two. Okay, first we'll discuss the viruses that are circular. Okay, so when we say circular, it means, tama class, it describes the orientation of your genome. So if you can observe here class on the genome, okay, the genome is circular. Okay. So this is a typical example of a circular DNA. Okay. Okay, so under Group 1, Baltimore's classification, DNA circular viruses, we have your Papilloma viruses. Papilloma viruses are a group of DNA viruses that shares a common characteristic. So they are double-stranded DNA, icosahedral, naked, and somewhat small, 45 to 55 nanometer. So Papilloma viruses is, as I mentioned earlier, it's a group of viruses. So therefore, may tatlong member siya class. So we have your Pa, highlight natin. So that's your Pa for your Papilloma viruses, which is the common cause of your common warts. And then for Po, we have your Polyoma viruses. And for Va, for your semen vacuolating viruses. Thus the name Papilloma viruses. But in this video lecture, we'll only focus on one member under your Papilloma viruses, which is your Papilloma virus. So again, as I mentioned in the previous slide, so under your Papilloma viruses, you have your Pa for your Papilloma viruses, and in humans, we have your human papilloma viruses. They have more than 60 genetic types, and then it is primarily associated with a variety of cutaneous lesions and benign growth, and that includes your plantar warts. If you can observe this one, which is caused by your human papillomavirus 1. And then you also have your common warts, ayan, familiar tayo dito, which is caused by your human papillomavirus 2 and 4. And yung mga human papillomaviruses that is associated with sexually transmitted venereal warts, so they are caused by human papillomavirus 6 and 11. So in this slide, I want you to memorize class the different human papillomavirus strains to its disease association. And also, if you can observe, diba, familiar naman tayo dito. Okay, I don't know the Visayan or Tagalog term for the common warts, pero diba may nakikita tayo usually ganito, even with or your friends. So this is actually caused by E virus. So this virus actually does not cause harmful effects in terms of like fever and etc. Why? Because the virus class, sulat natin, the HPV actually contains integrase. And integrase class is an enzyme which is capable of integrating the viral DNA genome to the host genome. So for example, you have this one. So this is our DNA. Okay? So, this is human DNA class. This is human DNA. Tayo to. Tapos, the virus have a circular DNA. So, ganito yung itsura niya. So, during replication class, they will release an enzyme called integrase. An integrase class, an enzyme that will try to integrate the genome, the viral genome to the host genome. So therefore, they will try to erase this one class. Sorry class. Na-erase ko na buo. So for example, ito na yung human class. Yan. So, ganito na yung dapat itsura niya, diba? Tapos, i-integrate niya yung class? DNA virus niya dito. Ayan. So, therefore, every time that the human host will have a replication class, diba? Dadaan si dito, DNA polymerase. So, every time na dadaan siya dito, magre-replicate the new virus. That's why the human papilloma virus that includes your common warts is somewhat long-term. Okay? So, the problem with this one class is that if left untreated, there would be possibility that the human papilloma viruses will be uncontrolled. So, sir, anong ibig sabihin ng uncontrolled? So, ang ibig sabihin ng uncontrolled class, remember that the human host regularly do their replication, right? So, therefore, pag ganun yung mangyayari class, what will happen? It will be uncontrolled and ganito yung mangyayari na class. In the next slide. So, ito na yung nangyari class. So, you have your epidermodysplasia verruciformis or 3-month. Okay, ito yung uncontrolled replication ng virus where the virus actually successfully integrate their genome to viral genome to human host genome. Okay? So, ito yung dapat iwasan natin class. Okay, so if you can observe, actually, if you will try to read other references, especially online references about 3-month, ito class, it's not painful daw. So they usually trim this one. Ibig sabihin ng trim, they cut because this will be an excess warts already. So it's not painful. So they will try to remove that one. And for your sexually transmitted venereal warts class, we have female genital warts. So you have this one. Okay, so this is somewhat dry. And then, it's not painful kasi hindi naman siya active inflammation. Second class is for the male genital warts. Okay, so the warts usually infect the epithelial cells, so therefore, yung sa lining niya. Hindi sa head, which is on the side. Okay? Because the side contains the epithelial cells. Okay? Ito naman, dito din sa side niya. Labia side naman. Sa anal naman na area, we have anal warts. Okay? Very common with gay people when they perform anal sex. So, ito naman yung itsura niya. Okay? So, magkaiba ang itsura ng anal warts mo with your hemorrhoids. Okay? I don't know if other subjects will gonna discuss hemorrhoids, siguro pagdating ng magme-med na kayo. Okay? But with this one, kasi pagdating sa infectious diseases class, as an infectious disease specialist, you need to have a good skill in anong term yan class? Ruling out other diseases. So for example, anal warts looks like hemorrhoids. How can we identify if it's an hemorrhoids or not? Ayun. For example, sa male genital warts naman class. Okay, dito, alam naman natin na warts to because the infection actually lodged on the side. Okay, ang almost kaparehan ng infection is syphilis, but syphilis usually infect the head part class. Okay? Tapos other bacteria infect on the shaft or body. Yan. So again, if you want to be an infectious disease specialist, you need to have a keen and good ruling out skills of other diseases. So, hindi lang pwede na ang alam mo lang is infectious disease. You need to consider also other diseases that may look like a infectious disease. So, for transmission, so you have direct contact and then sexual contact. For genital infections associated with neoplastic lesion, including cervical carcinoma or oncogenetic, we have your HPV or human papilloma virus 16 and 18. Take note with this one class ha, ano yung mga human papilloma viruses that can actually cause cancer. You have your HPV, human papilloma 16 and 18. For the laboratory diagnosis, so histopathologic cytologic examination of cutaneous biopsy or cells or DNA probe assay remains the gold standard. So it's still invasive. Okay, for treatment, syempre surgical or chemical removal. Pag prevention naman class, avoid contact with infected tissue. So therefore, if you are sexually active, so what you need to do, pag hindi mo makontrol, you need to check first your partner if kung meron bang visible lesions and or warts. Ayan. So check the area first. And then after that one, kung okay naman, then you're good to go. Okay? And then other strains, so you have your Papilloma. Strains for JC and BK, they produce mild asymptomatic infection and spread through respiratory secretions. Yan. Kasi sa board exam 2 years ago, class, lumabas yung strain JC at saka BK, kung ano daw yung mode of transmission. So, paki-highlight na lang din, class. Highlight natin, class. You have your respiratory secretions. Okay, so we're done with your Group 1 Baltimore's classification DNA circular viruses. So we'll move to your Group 1 Baltimore's classification DNA linear. Okay, so kanina yung diniscuss natin is mga viruses under circular. So this time we'll discuss your viruses that under your Group 1, still Group 1, pero yung genome characteristic niya class is linear. So, we have your Adenovirus. Okay, so paki-take note lang class, pag naming, pag viridae, yung may last na day, ibig sabihin yan class family. Okay, so yung under kay Adenoviridae, andun si Adenovirus. Okay, their name derived from their initial isolation from human adenoids in 1953. Okay, they belong to the genus Masta, Adenoviridae. They are naked, icosahedral, okay, double-stranded DNA with a size of 70 to 90 nanometer and has 49 serotypes. So, ibig sabihin, class, there would be a possibility that the virus, okay, for example, in this case, adenoviruses, can actually cause infection 49 times. Okay, there are some viruses that, there are some strain of viruses that if you are infected, you have the immunity already. But there are some viruses that even that it's the same strain, your body cannot produce a good long-term immunity. So therefore, na-infect at saka na-infect ka talaga. Okay, for serotypes under your adenoviruses, so you have your 1 to 8, 11, 21, 35, 37, 40, which is commonly isolated infection. So sore eyes is an infection caused by your adenoviruses. Okay, so sore eyes naman is a general term, and then the medical term na ginagamit naman natin class is conjunctivitis. Okay, conjunctivitis, which is caused by your adenoviruses. So for the viral structure class, okay, maganda yung structure ng adenoviruses. Why? Because they have a prominent spikes, and that includes your penton base, okay, that carries a toxin-like activity that causes rapid appearance of your cytopathic effect and detachment of cells from their surface. And then we also have your hexon fiber that contains type-specific antigen. So ito yung ginagamit natin class to serotype the virus strain that are important in serotyping associated with heme agglutinating activity. Okay, on next Saturday class, I will post a video for your cytopathic effect because this week I am doing MDCK, which is a cell culture line for influenza. So starting tomorrow, Monday, I will observe the cytopathic effect with my influenza virus for 7 days. So I will try to record 8 class for you, and then at least makita nyo naman kung ano yung CPE, not only through books but also through practice. So again, class, as I mentioned, they are classified in 2 genera, and the adenoviruses, they actually belong to your masta. Okay, adenovirus, because this virus infect mammals. And then you have your V adenovirus naman class that infect birds. Okay, human adenovirus class, they are divided into 6 groups, so from A to F. Then they replicate and produce disease in the epithelial cells of your respiratory tract, gastrointestinal tract, urinary tract, liver, and in the eyes. That's why we have your conjunctivitis. Okay? So adenoviruses usually do not spread beyond the original lymph node. So they are actually restricted to adenoids. However, group C persists as latent infections for years in adenoids and tonsils and are shed in feces for many months after initial infection. So to review your anatomy class, I don't know if you can still remember the location of your adenoids. Your adenoids is located on the upper palate of your tongue, this one. Okay, so that's your adenoids. Then for group C, they usually go to adenoids and then with your tonsils. This one is your tonsils, okay, which is this one. Kikita niyo dito. And then they shed in your feces for many months after initial infection. So for adenoviruses that can cause respiratory diseases, the most common manifestation would be cough, nasal congestion, fever, and sore throat. Okay, the most commonly caused group of adenovirus with the respiratory diseases is group C. Adenovirus type 3, 7, and 21 actually link for more than 10 to 20% of pneumonia in children. And then for your type 4 and 7, occasionally type 3 cause of your acute respiratory distress syndrome among military recruits. So please take note with this one. So for the adenoviruses, if you can observe in this one class, okay, these are X-ray films. So this is a typical example of a normal lung. Okay, so there will be no shadow. Though may shadow dito class, that's your heart. And then this one is a typical characteristic of your lobar pneumonia. Okay, ito yung harap niya naman dito class, and then this one. Okay, for your lobar pneumonia class, okay, which is causative agent niya ay lobar kasi class, so you have your Streptococcus pneumoniae. Okay, this is typical characteristic of your lobar pneumonia. Compare with this one class that this spot is on the apical one. So therefore, we can say that the organism is aerobic. Okay, that is a bacteria. Compare with this one, Streptococcus pneumoniae, as we learn in our bacteriology that they are facultative anaerobe. So therefore, they can actually survive on the lower part, which is the lower part of your lungs. Okay, please review your anatomy class para makafollow kayo. Okay, and then compare with this one that the organism, if you can see on the spots, that's the spots. The spot is on the apical part. So therefore, the organism is facultative and or obligate aerobe. And this is a typical example of your apical spot. Okay, apical spot is a characteristic of your Mycobacterium tuberculosis. Compare with this one class that the spot is actually dispersed because viruses, they don't require oxygen to grow. So therefore, pag kalat-kalat yung spots mo class, possibly the organism is adenovirus and or other viruses that can cause respiratory diseases. So we also have adenoviruses, as I mentioned before, that can cause eye infection, which is your conjunctivitis. If you can observe the development of your conjunctivitis from a normal one to the inflammation of your conjunctiva. Okay, it can actually cause mild ocular involvement and may be part of the respiratory pharyngeal syndromes. Okay, for your pharyngoconjunctival fever, they occur in outbreaks such as at children's summer camps, swimming pool conjunctivitis, which is associated with your type 3 and type 7. So please take note with this one, class. Pag outbreaks of your swimming pool conjunctivitis, ano yung type ng adenovirus natin? Class, tama, type 3 at saka type 7. I think lahat naman tayo, class, naka-experience ng sore eyes and or conjunctivitis. So at least we can relate that the causative agent of this one could possibly adenovirus. Take note, class, that conjunctivitis or sore eyes is a general condition. It could be possibly caused by other factors such as external factors such as dust, possibly also bacteria, fungi not common, and or viruses. So therefore, again, you cannot solely link conjunctivitis to adenoviruses because madaming factors that can also produce conjunctivitis. So next, we have your epidemic keratoconjunctivitis. So kung makikita niyo dito, class, meron na tayong inad na kerato. Okay? Yeah, most serious disease occurs mainly in adults and highly contagious. Okay, caused by your type 8, 19, and 37. So, bakit nag-add na tayo ng kerato, class? Because it is characterized by acute conjunctivitis. So, anong ibig sabihin, class? It will start muna sa pumumula ng mata, followed by keratitis. That usually resolve in 2 weeks, but may leave subepithelial opacities. Ibig sabihin na opacities, class. Alam niyo naman yung opacities, diba? Yung opaque. So, ganito yung itsura niya, class. Opaque. Ito yung opacity niya, class. Yan. Yan, kita nyo. Parang nana lang siya, class. Okay? Opacities in the cornea for up to 2 years. In addition, adenovirus can remain viable for several weeks on sinks and hand towels as source of transmission. So therefore, class, be careful. Like sa Pilipinas, di naman uso ang onsen. So onsen kasi sa public bath. So therefore, common yung mga towels and or hand towels na ginagamit. But in Philippines, so hindi naman siya practice, so I think it's okay. In Japan, wala namang masyadong cases of adenovirus because they have a strict standard of disinfecting all the hand towels and or sinks for public bath. So, in addition, also, class, adenovirus can cause gastrointestinal disease. So, if you can observe, class, di ba, grabe si adenovirus, lahat na lang. Pag tinanong naman kayo, class, bakit andun din siya sa gastrointestinal disease? Remember, class, that adenoviruses can be shed to feces. So, therefore, dadaan talaga din siya sa gastrointestinal diseases. But not all. Okay? So we have most common types of adenovirus that can cause gastrointestinal disease. You have your type 40 and 41 associated with infantile gastroenteritis, which is 5 to 15% cases of viral gastroenteritis in young children. Other diseases naman, class, include type 11 and 21, acute hemorrhagic cystitis in children. Children receiving liver transplant may develop adenovirus hepatitis in the allograft, possibly. Okay, but rarely naman, class. Children with heart transplant may develop myocardial adenovirus infection and are at risk of graft loss. And patient with AIDS, okay, immunocompromised, may suffer adenovirus infection. So adenoviruses can actually cause different diseases, and then if you can observe, yung pinaka vulnerable are children because of their immune system and of course their lifestyle, class. For the laboratory diagnosis, we can use virus isolation culture by the use of your primary human embryonic kidney cells, which is the most susceptible, usually usually not available. And then we can also use your Hep2, HeLa, and KB, which is sensitive but difficult to maintain kasi yung way of passage naman niya, class. Okay, the characteristic CP naman, class, paki-take note for adenoviruses, rounding and clustering of swollen cells. Addition for your laboratory diagnosis for adenoviruses, you have your immunofluorescence test using your anti-hexon antibody, as I discussed on the previous slide, class, about the structure of our adenovirus. Then we can use an antibody that will detect the hexon part and then will produce a coloration. So yeah. We can also use your shell file technique, which is a rapid detection. Okay, I hope that you still remember the shell vial technique mentioned in the last part of our laboratory diagnosis. And also we can use your serology using your ELISA or latex agglutination test. You have your CF test, complement fixation test naman to, class, which I believe explained in your serology class. So for the prevention, since your epidemiology is widespread, the prevention would be careful hand washing. Okay, that's the easiest way. And the environmental surface, disinfected with sodium hypochlorite, pwede namang alcohol din, class. For treatment, those specific treatment pa na meron. So therefore, prevention and control is the best way to prevent your adenovirus infection. That's why, class, if you are infected with conjunctivitis or sore eyes, you are restricted to touch inanimate objects. Bakit? Because adenovirus can survive outside the host cell. So therefore, if someone will gonna touch that one na ikaw yung huling gumamit, and then according to Forbes study, class, that we usually touch our face 300 to 400 times a day. So there would be a possibility that you can actually get that infection. So please, careful hand washing. Okay, that's the easiest way for us to prevent the adenovirus infection. Okay, so now we'll move to your Baltimore's classification group number 1, envelope. Okay, class, envelope naman, class. Okay, kasi yung dalawa naked, diba? So eto, envelope. Okay, so for envelope, class, eto madali lang kasi ang pinaka-common na andito is you have your herpes viruses. For herpes viruses, so you have 3 families. You have your alpha herpes virinae, beta herpes virinae, at saka gamma herpes virinae. Under your alpha herpes viruses, so you have your type 1, type 2, and then you have your varicella zoster virus, which is the causative agent of your smallpox and shingles. Varicella for your smallpox, shingles for your zoster virus. And then you also have your beta herpes virinae, that's your cytomegalovirus, CMV. You have your herpes simplex virus type 1 and type 7. And for your gamma herpes viridae, that's your EBV, Epstein-Barr Virus, which is the causative agent of your kissing disease. We'll discuss that one later, class. Okay, let's start with your herpes viruses. In structure, they are spherical. Okay, 150 to 200 nanometer in diameter. Okay, icosahedral and double-stranded DNA. As I mentioned, that these viruses are envelopes whole, meron silang envelope with viral glycoproteins. They produce latent viral infection in WBC and peripheral nerves. So for reactivation, associated with immunosuppressed patient with underlying conditions and those undergoing chemotherapy or corticosteroid therapy. One example of this one class is your varicella zoster virus, which is the causative agent of your smallpox. So if you have smallpox, so for example, nagka-smallpox ka nung bata ka. So pag nagka-smallpox ka ng bata ka, naka-recover ka, possibly that the virus, varicella zoster virus, have a latency on your body. Sa anong mangyayari? Sir, anong ibig sabihin ng latency? Pag sinabi kasing latency class, they are dormant. Ibig sabihin ng dormant, ano sila? Resting. Okay, they are not actively dividing or they are not actively replicating. Pero andun sila sa katawan mo. Okay? So yun yung latency. Tapos yung varicella zoster virus na naging latent sa katawan mo, tapos after ngayon, kasi masyadong stress ka na, kasi tambak na sa requirements, tapos masyado ka ng stress, tapos nagulat ka na lang, nagkaroon ka ng second chickenpox. So, ang second chickenpox naman class, we call that one shingles. Ayan. So, we'll discuss that one later. Papakita ko sa inyo yung characteristic ng shingles. Yun yung reactivation natin, class. So, you have your herpes simplex virus 1 oral strain. Usually, with the herpes simplex virus 1 class, they cause infection above the waist. Okay, and the infection is mild infection and less resistant to treatment for transmission through active ulceration of the mucous membrane associated with gingivostomatitis, ulcerative mouth lesion, and fever blisters. And then may spread to lips and cheeks. So this is the best example of your herpes simplex virus 1 oral strain. So in the previous slide, we mentioned that we have herpes simplex virus 1 that infect the upper waist. We also have virus or herpes simplex virus that infect the below the waist, and we term that one herpes simplex virus 2. Which is a genital strain. 80 to 90% of genital herpes is a common sexually transmitted disease. So therefore, class, if you will commit sexual interaction, what will happen? You can actually transfer the virus to your partner. Common signs naman, class, compare with other viruses na na-mention natin in the previous slide, na somewhat asymptomatic siya. With this one, merong fever, mali, at saka inguinal lymphadenopathy. So, inguinal lymphadenopathy, kung sa Bisaya pa class, that's your luas janay. Ito, ano nga yan sa Bisaya class? Lusay. Ayan class. Okay? And then the primary lesion appears in vagina, cervix, glands or penile shafts. So, makikita nyo nasa shaft class body. Ayan, kita nyo yung lesion. And then may possibility na recurrency. So, ibig sabihin ng recurrency is that pag nag-heal, nagkakaroon ng reappearance ulit. Okay? Meron din tayong tinatawag na neonatal herpes simplex virus type 2. Okay, acquired during delivery. So, the problem with this one is that if the mother doesn't care too much and then hindi siya nagpa-check, what will happen, class? Okay, the virus once after delivery, the virus can actually enters and attacks the infant's central nervous system. And then possibly, pwede siyang mamatay. For the laboratory diagnosis class, okay, you have your lesion or conjunctival lesions. So, pwede natin siyang kunin as specimen. And then direct examination of your virus, we can use your electron microscope. Pwede din pap smear, okay, or direct fluorescence assay, indirect fluorescence, at saka immunoperoxidase. For your ELISA, we can use this one, cell cultures and shell vial culture. For the characteristic pakitig ng class of your CPE, you have your round clamping, syncytial, giant cells. For other infection caused by your herpes simplex virus class, we have your herpetic keratitis. So therefore, class, we can actually observe this one as infection, and then herpetic whitlow naman class sa kamay. Yan. Herpetic keratitis at saka herpetic whitlow, okay, which infect fingers, as occupational hazard seen in AIDS. You have your acute immunodeficiency syndrome commonly caused by your HIV. So we are now on your varicella zoster virus, or VZV. As I mentioned, class, causative agent of your chickenpox, a child disease, child skin rash with raised fluid-filled lesions. Okay? So ito yung tatlong characteristic naman yung class. It will start with papule. And then after that one class, nagiging blister siya. Tapos kung puputok na, nagiging ulcer. Okay? So if you can observe, this is a general characteristic of your chickenpox. Tapos kung merong reactivation class, then you have your varicella. Okay? Or herpes zoster or shingles. A reactivation form of your latent varicella. So ito yung sinabi ko kanina, pag na-infect ka ng chickenpox, nung bata ka pa, so there would be a chance that di naman masyadong malaki yung chance, class, because not all the virus have the capacity to become latent. So if kung naging latent yung chickenpox mo, class, which is your varicella zoster virus during your childhood, tapos masyado ka ng stress ngayon, then you can have your shingles. Ito naman yung shingles, class. Shingles, since naka-ano sila, class, tawag nito, nasa spinal line yung ano nila, spinal cord, yung latency nila. So therefore, dapat yung manifestation niya, class, is pag nasa likod nito na part, class, from the back ng spinal cord to here. Ayan. Yan yung itsura niya. Okay? And then, please review and then list all the latency cells ng herpes viruses mo. And because we will try to include that one in your quiz and your exam. So, virus remains latent in the dorsal root ganglia. Ito yung sinabi ko kanina, class, or peripheral cranial nerves. And then shingles, a disease of the elderly and immunosuppressed patient. And or those patients that have that had a chickenpox before. And then complication includes neuralgia, keratitis, ophthalmia, hearing loss, facial paralysis, at saka aseptic meningitis. So sinabi siyang aseptic meningitis, class. Bakit? Kasi aseptic. Pag sinabi natin aseptic, di ba, clean. So ibig sabihin yung, class, walang nakitang bacteria, walang nakitang fungi. Kaya siya tinawag na aseptic meningitis. Yun. Tapos, kung itatanong, sir, hindi ako nagkaroon ng chickenpox, possible ba akong magkaroon ng shingles? No. So first, dapat magkaroon ka muna ng chickenpox. Kasi yung shingles is a reactivation of your varicella zoster virus. So ito yung pathway of herpes infection. So the herpes enters the body, tapos herpes lies dormant in the nerves. Ito, and then if kung may reactivation causing your shingles. Okay? Then let's move to your cytomegalovirus, or you have your human herpes simplex type 5. Okay? So pagdating sa exam or quiz, pag hindi lumabas si cytomegalovirus, pwede nating isagot si human herpes virus type 5. Okay? Formerly known as your salivary gland virus. Okay? They are a member under your beta herpes viridae, class. Okay, opportunistic infections, okay, transmitted through direct contact with saliva, blood transfusion, and organ transplant. So you have your CMV. So they produce asymptomatic or mild infections. However, they are latent in WBC, endothelial cells, and other organs. Paka-highlight, class, saan sila latent? Sorry, class, saan sila latent, class? You have your WBC, endothelial cells, and other organs. And then we also have your congenital CMV, or congenital cytomegalovirus, that occur as primary infection during pregnancy if the mother lacks antibody to the virus. So therefore, class, as future mothers, so you need to have a complete screening test if you have this one, especially those women that are sexually active. So it's not just for you, but for your future baby. So specimen used for laboratory diagnosis, we can use your urine, saliva, tears, milk, semen, and vaginal secretion. For the direct cytology, if you can observe this one class, I actually included this one already during your laboratory diagnosis. As part of your CP characteristic, you have your ALS-I. ALS-I is a hallmark characteristic of your CMV or cytomegalovirus. They are described as large cells with basophilic staining inclusions within the nucleus. So therefore, class, they are actually effused, okay, two fused cells, okay, isolated in cell culture and cell vial. You can use that one. And then paki-highlight na lang din, class, that the CP characteristic is rounding of the cell and or pwedeng ALS-I appearance. Next class, you have your human herpes simplex virus 6, okay, member of your beta herpes virus. So, kapatid siya ni V5 Cytomegalovirus. Okay, first known as your human lymphotropic virus. Okay, detected infecting B cells, isolated in saliva and mononuclear cells. The transmission is through respiratory route. And then the agent of your exanthema subitum or rosola, known as the 6 disease, came. Benign child disease, 6 months to 3 years. So, exanthema subitum naman, class, or rosola. Yan. So if you can observe this one, this is a typical example of your exanthema subitum, parang Harry Potter lang, class. Yan. Next is you have your Epstein-Barr Virus or EBV. Okay, kung hindi makita si EBV, class, so hanapin si human herpes simplex virus type 4, agent of rare infectious mononucleosis. Okay, so EBV is a member under your gamma herpes virinae. Okay, they shed in saliva and transmitted through oral contact. That's why the disease is usually called kissing disease. Yeah. Sa Japan, class, ang daming cases ng EBV. One of our viruses na pinofocus sa laboratory class is Epstein-Barr Virus. Because in Japan, very common. Yan. Tapos latent pa, asymptomatic pa talaga, class. So magugulat ka na lang na may EBV ka na pala na kuha. If kung you will try to, like, you know, have a intimate actions to your partner, for example, and then this one. So the EBV infection, nasa next slide ko pala, class. So the virus replicates first within epithelial cells in the pharynx, which cause pharyngitis or sore throat. Very typical, class, diba? Very typical symptoms. Pwede siyang bacterial, pwede din siyang other viral agent. And later, primarily within B cells. Take note, class, paki-highlight ang latency at saka target cells. Yan naman, class, is B cells. And paki-highlight na lang din to, class, kasi lumabas sa board exam, which are invaded via their CD21 receptor ng B cells mo naman, class. Those cell immune response involved cytotoxic CD8 positive T cells against infected B cells, resulting in enlarged atypical lymphocytes. And that atypical lymphocytes, class, we call that one, pagdating sa hema, ano, class? Tama, class. Downy cells. Yan. Paki-highlight, class, downy cells. Yan. For reactive lymphocytes, class, the distinctive cells associated with EBV or CMV is known as your downy cells. Okay? Pag reactive lymphocytes, ang tawag sa kanya, downy cells. After downy cells, the downy cells is, the term downy cells class, the term downy cells is from Hal Downey, who contributed to the characterization of it in 1923. Yan. So, tandaan natin class, downy cells are reactive lymphocytes associated with your ABV, tapos B cells kasi meron siyang CD21 receptor. So, your EBV class disseminates in your reticuloendothelial system that includes your liver, spleen, and lymph nodes. For the characteristic of the disease class, very common fever, sore throat, enlarged lymph node and tonsils, splenomegaly, hepatomegaly, at saka elevated liver enzymes. That's why class, ito as a physician, usually think that for example, pag may pasyenteng pumunta sa hospital tapos yung major complaint is fever, sore throat, at saka enlarged lymph nodes, at saka tonsils. Siyempre, hindi pa makita yung splenomegaly at saka hepatomegaly, di ba? Pag first muna, tapos hindi din nagpa-test ng elevated liver enzymes. So, usually, pag ikaw ang doktor, usually, ang impression mo is that, bacterial infection to. So, magbibigay ako ng antibiotic. Tapos, pag nagbigay ka ng antibiotic class, your EBV can actually cause rash, okay? Or allergic rash pag uminom ka ng antibiotic tapos EBV yung cause mo, hindi bacteria. Yan. Tapos pang-confirm na lang din yan. Tapos bumalik ka, pagbalik mo sa hospital, nagulat na lang yung doktor na bumalik ka kasi may allergic reaction. Sabi mo, Doc, I have an allergic reaction with the drug. Pero wala naman ako penicillin for to be specific. And then sinabi mo, Doc, di naman ako allergic sa penicillin, bakit nagkaganito? And then the doctor will have a hint, okay, possibly this will be EBV. Ayun, class. EBV does not require naman like long-term treatment because EBV is a self-limiting disease. However, there are some conditions that, EBV can actually cause splenic rupture, hemolytic anemia, encephalitis, and chronic EBV infection. Sorry, class EBV yung nasulat ko dyan. EBV yan sa class EBV, chronic EBV infection. So, sir, bakit nagkaka-chronic? So, bakit sila nagtatagal kung sinabi mo, sir, na self-limiting? Always remember, class, that your herpes viruses, they have latency. In this case, your EBV has a latency to your B cell. So, therefore, di ba, paulit-ulit ko sasabihin to, class, pag latency, they are capable of making dormant. Hindi sila nagre-replicate. So, therefore, the virus will not be detected with your immune system. Okay, so before we will proceed to Baltimore's classification group number 1 complex, which is your variola viruses or smallpox, review muna natin yung herpes viridae in yung class. So always remember, class, that the alpha viruses which establish latency on neurons, take note with this one, class, okay? Latency ng alpha viridae mo, class, is neurons. Pag beta herpes viridae mo naman, class, establish latency, sites where virus lies dormant until reactivated in, saan, class? Leukocytes. Okay, tandaan, pag alpha, neurons. Pag beta naman, class, you have your leukocytes. Pag gamma naman, class, gamma herpes viridae, which establish latency in cells of the immune system, such as your B cells. Okay? So, yun lang yung mga dapat natin tandaan, class. Latency ng herpes viridae viruses mo, class. So, again, we'll move to your group 1 complex. Okay, sir, bakit siya, nilagay na naman sa complex? Bakit hindi pwedeng nasa envelope at saka naked na lang? Kasi, class, the nature of the structure ng smallpox mo does not belong to envelope at does not belong to naked. So, therefore, they are regrouped and classified to complex. Okay? Alimaw Maalin, okay, the last case of smallpox in Somalia in 1977. And then in US, United States, the last occurring smallpox case is on, class, same lang pala to, Somalia pa rin pala, class. That's on October 26, 1977. And then a year after, hindi a year after, kasi 1980, 3 years pa, 1977, 88, 89, 80. So, therefore, 3 years, 1980, the WHO declared smallpox completely eradicated. Yan. And we are thankful for the vaccine for that one. So hopefully, if all will gonna take the vaccine for COVID-19 or coronavirus 2, then I think the virus will be eradicated soon. So you have your Herpes virus, okay, the largest and most complex virus. Okay, they have an oval or brick shape or ellipsoid around 400 nanometer by 230 nanometer. External surface shows ridges containing core and lateral bodies. So, para siyang dumbbell shape, di ba class? Kita nyo. Dumbbell shape yan. Tapos tinanong sa EUBF nyo class, what is the dumbbell shape crystal? So, you have your calcium carbonate. Calcium carbonate, diba? Pag dumbbell shape appearance naman class is, pag virology naman class, you have Herpes Viruses. So, double-stranded DNA enveloped with multiple membranes. Kaya siya tinawag na complex. Kaya siya under complex class. Family members includes variola, you have your smallpox virus, vaccinia virus, agent of your cowpox, at saka monkeypox. So, if you can still remember your immunology, diba? So, you have your cowpox, diba? Dun kinuha yung first vaccine, tapos tinransfer sa tao. So, the causative agent of your cowpox is your vaccinia virus, which is somewhat similar to your variola in terms of their structure. So, naging effective na gumamit ng cowpox as a vaccine for your smallpox. So, virus-encoded protein helps invade host immune defense system. So, that's how the virus, which is smallpox, is difficult to control that time, because the immune system is trying to fix or control the virus. However, the virus contains viral proteins that restrict the immune system actions. Okay, they are very resistant to inactivation pagdating sa labas or environment. They include epithermal growth factor and transforming growth factor alpha that accounts the proliferation of the disease. And then Pox virus include host defense modifiers class, okay, proteins which inhibit host defense mechanisms such as TNF, tumor necrosis factor, receptor, interleukin-1 receptor, complement binding proteins. So always remember class, this one is under your innate immune system. Then that includes your complement binding protein, or you have your CRPs, for example. So, pagdating pa lang sa innate immune system, tapos block na kagad, what will happen? So, mas mahirap siyang i-control. So, smallpox, i-rundown lang natin to class kasi I believe that immunology discussed this one. The immunology course discussed this one already. So, smallpox caused by a variola virus, ancient disease that killed millions. Transmission is direct respiratory contract and multiply in lymph nodes. And then smallpox was declared eliminated or eradicated in 1980, as I mentioned before. And then variolation at saka vaccination helps eradicate smallpox. Yeah. So I hope that the immunology teacher were able to discuss and differentiate the two, variolation and vaccination. But if you have some question in class, so please beat me up with the definition of these two. Ayan. Kasi if I'm gonna discuss everything, it will take 2 hours or 3 hours for the discussion. So let's make it simple, and then as much as possible, virologic point, hindi siya immunologic point. Yeah. For laboratory diagnosis, we can use your skin lesion for specimen of choice. So, kinukuha natin yung skin ng ganda class, diba? Ang ganda ng tignan yung class. Ganda ng lesion, diba? Yan. So, pox virus are stable and may remain viable in specimens without refrigeration. For virus isolation, inoculation of vesicular fluid. So, ayan, tinatanggal natin, pinipisa natin yung glass into the chorioallantoic membrane of the chick embryo. Ayan. The most reliable laboratory test, but tedious and not usually performed, as we discussed that one during your laboratory diagnosis. PCR also available. So, ayan, mas maganda ang PCR, mas madali, mas mabilis. Serologic test also includes ELISA, then radioimmunoassay, RIA, immunofluorescence test also are readily available in the laboratory. In the US at saka in Russia class, they are still actively researching your pox virus or smallpox virus. Not because of tawag nito, possible na i-release nila in the future, but we don't know, right? But meron mga conspiracy that the virus could possibly use as a bioterrorism tool. So therefore, they are actually studying possible, drug and or other treatment for the prevention of epidemics pag ginamit na bioterrorism tool si pox virus. For treatment, you have your vaccine na immunoglobulin, then metazazone, at saka chemotherapeutic agent. For metazazone, USAN or metazazone INN, USAN saka INN is the company name, is an antiviral drug that works by inhibiting the mRNA and protein synthesis, especially in pox virus and class. Ang kagandahan ng drug is that it directly inhibit the genome function, okay, at saka protein synthesis, especially in pox virus. So it has been used in the past to treat smallpox, okay. So at least if kung lalabas man siya, we still have this one, okay, metazazone, USAN at saka INN. So under your pox viruses, we also have, other than your smallpox and cowpox, we also have your monkeypox, caused by a species of orthopox virus. First recognized in captive monkeys in 1958. However, may cross-infection na human infections with the virus discovered in 1970s in West Africa and Central Africa. The infection or the virus is acquired by direct contact with wild animals. So we don't know the culture sa Africa, especially West Africa, on how they acquire that one. Maybe physical contact last or occupational contact, where they usually get wild animals as a source of food. And then, cowbox infection caused by species orthopox virus. Ayan. Ganda, di ba? Parang class? Pizza at saka pepperoni lang ang dating. Yan, gutom kasi ako, class. So, para siyang pepperoni. Yan. So, I really like seeing mga ganito, class. Tawag nito? Lesions, for example. And then milder form of pox virus occurs in cattle, as we all know this one already and discussed with your immunology. And then human infections occur by direct milking and lesion of milkers, usually confined in the hands. So during your immunology course, the class, your teacher discussed this one already, that Jenner observed that cow handlers or milkers have mild form of smallpox infection, and then after that one, pag na-expose siya sa smallpox, hindi na siya nagkakaroon ng severe disease. Fever na lang, for example. Kaya sabi ni Jenner, baka ito may cross-reactivity, kaya pwede nating expose yung tao with a low-key virus, which is your cowpox, that does not cause death to humans compared to smallpox. And we also have your buffalopox infection. Okay, buffalopox virus, a derivative vaccinia virus that has persisted in India in water buffalo. Yan. So again, it can be transmitted to humans via direct contact. So we don't know the culture in India, possibly that the virus is transmitted via occupational interactions. And we have your Orf virus, okay, virus of the Orf, species of parapox virus caused by disease in sheep and goats, okay, worldwide prevalence, transmitted to human via direct contact again. So the same with the other explanations class, with the possible culture again, and then occupational contact. And then we also have your molluscum contagiosum. Okay, molluscum contagiosum. Okay, benign epidermal tumor that occur only in humans. Ayan. Tapos causative agent class, Molluscum virus genus, not transmitted to animals, so therefore restricted only to humans. Usually class your molluscum contagiosum is very common to people who are suffering with AIDS or acute immunodeficiency syndrome. And then sexually transmitted siya. So aside from, so therefore class, you need to have a sexual intercourse to get this one. Then we have your Tanapox and Yababa monkey tumorpox virus infection. For Tanapox, common skin infection in parts of Africa, mainly in Kenya and Democratic Republic in Congo. Yan, di ba? Ang galing, ang daming diseases coming from Africa class. The natural host is monkey, and then classified as the Yatapox virus genus, morphologically similar to your Orthopox virus genus, and then human infection via direct contact. Again, as I mentioned before, that the direct contact is via maybe occupational exposure, since probably in Kenya and or in Democratic Republic in Congo and some part of your Africa, one of their major source of food is hunting wild animals, and that includes monkeys. So therefore, baka doon nila nakuha class. So we are now done with your Group 1 Baltimore's classification. So we will move to your Baltimore classification group number 2, which is very, very short class. Yan. So your parvovirus B19 is under your group number 2, Group 2 Baltimore's classification. They infect your proerythroblast. Yan. Pag tinanong sa exam kung saang lineage or stage ng erythrocyte maturation series nag-e-infect si parvovirus. So you have your proerythroblast or pronormoblast. Yan. And then your proerythroblast will become giant proerythroblast, and then if kung hindi na ma-contain, nagbablast, kaya nagkakos tayo ng tawag nito, pagbaba ng number ng red blood cells mo. So, parvovirus B19 under the family of your parvoviruses, they are single-stranded DNA. Ayan, single-stranded na tayo kasi ng group 1 double-stranded lahat. With group 2 single-stranded DNA na siya. Class naked, icosahedral symmetry, very small, 18 to 26 nanometer in diameter. Extremely resistant to inactivation. As we all know, pag may mga ganito kasi na node class, extreme risk and inactivation, tingnan nyo kagad kung ano ang characteristic structure ng organism or ng virus naked. So majority of the naked viruses, they are resistant to inactivation compared to envelope. Because envelope proteins are lipid proteins. So therefore, ang lipid proteins, madali lang siyang ma-inactivate or madali lang siyang mapatay. Yan. So, madaling i-control ang mga envelope viruses compared to naked viruses. And the virus is stable at pH 3 and 9 and withstand heating at 56 degrees Celsius for 60 minutes. So, the inactivated by formalin at saka beta-propiolactone and oxidizing agents. So, pag gumamit tayo nito, possible na mamamatay yung organism or virus known to infect mice, hamsters, cats, at saka dogs. Pero, yung pinaka-common is you have your dogs. Yan. So, sino yung may mga dog lovers or mga dogs, diba? Yung mga vet nyo talaga, nire-recommend na dapat magkaroon ng parvo B19 vaccination. So, you have your two subfamilies. So, meron tayong Parvovirinae, infect vertebrates, genus Parvovirus at saka Retrovirus. They able to replicate autonomously in rapidly individual cells. So, ibig sabihin ng autonomously class, so sila-sila lang. May mga virus kasi class na nagre-record din ng other virus for them to replicate. Ayan. And then you have your densovirinae class. So for densovirinae, they infect insects, okay, defective members, depend on the helper virus for replication. So ito yung sinasabi ko kanina class. Yung kanina, autonomously can replicate naman sa class. Etong densovirinae naman class, kailangan niya ng adeno at saka herpes virus for them to replicate. Parvovirus B19 is known to infect humans, only members of the genus Retrovirus. And then K9, Parvovirus, infect dogs. In class. So again, yung Parvovirinae mo naman class, that includes your Parvovirus at saka Dependovirus. Kaya siya tinawag na Dependo kasi nagde-depend siya sa Adenovirus at saka Herpevirus compared to your Parvovirus class. Tapos, si Retrovirus naman class, ito yung nag-infect sa humans. Ito. Also class, the virus was discovered by chance in 1975 by Australian virologist Yone Cothart. It gained its name because it was discovered in well B19 of a large series of microtiter plates labeled in this way. So, ganito yung itsura niya class. Drawing ko. Bakit hindi nyo alam yung ano? So, ito yung itsura ng microplates natin. Tapos, pag ganun kasi siya class. Pag ganun siya, di ba? Microwells kasi siya. Tapos, dito, merong A. Tapos B. Class. B, C, D, E, F. Pag ganun. Tapos dito, 1, 2, 3, 4, 5, 6, 7, 2, 19, tapos 20 for example. Tapos, may something wrong daw sa B19 dito. So, nag-positive daw siya. Kaya, during the naming, classify siya as B19. Ayun. Yun yung sabi nila class. And then, Parvo is a Latin for small. Because, as I mentioned in the previous slide class, diba, they are small. For human disease associated with B19, so you have this one. You have your erythema infectiosum, paki-highlight class, erythema infectiosum naman class, or fifth disease. Diba kanina nabanggit ko yung first disease, tapos meron namang fifth disease class, that's your erythema infectiosum. Okay, host or condition, children and or adult, clinical features naman class, cutaneous rash at saka arthralgia, arthritis. Tapos, your Parvovirus B19 also class can cause transient aplastic crisis, underlying hemolysis naman class, severe acute anemia. Bakit kasi, diba, tinatarget niya yung isa sa mga step ng erythrocyte lineage mo, class. And then, also pure red cell aplasia. Aplasia, class, ibig sabihin pagkawala talaga, diba? Immunodeficiencies at saka people who are affected is immunodeficiencies. And then, chronic anemia naman yung clinical features. Tapos, hydrops fetalis naman, class, okay, that can actually cause abortion with fetus and fetal anemia. So, hydrops fetalis, I know that you encounter this one, class. Hydrops fetalis is also observed in Neisseria meningitidis, class, and Neisseria gonorrhoeae. So for your erythema infectiosum, which is the fifth disease, a childhood illness, okay, that includes measles, rubella, varicella zoster virus, at saka rosola, common childhood exanthem. Pag sinabi natin exanthem, class, ayan, pauso na naman tong virology, class. Ang exanthem is rush, ayan, class. So rush na pwede mo siyang ma-feel outside, ayan, exanthem, okay. So, pwede mo na itong gamitin, class. Wag ka nang gumamit ng rush. Wala, may rush ako. Wala, I have exanthem. Ayan, para social. And then, mode of transmission, respiratory route, parenterally, blood transfusion. Pwede din vertically, mother to fetus. Clinical features include fever. Okay, for your parvo B19, a unique slapstick appearance. Ayan, slapstick appearance. Okay? So, meron din tayong ganitong itsura, class. Sa mga old patient, ang characteristic naman natin dyan, class, is butterfly rash, diba? So, sa butterfly rash naman, class, it is associated with your SLE, okay? Systemic lupus erythematosus, okay? So, you need to differentiate the two in terms of its characteristic. Has an affinity to RBC precursors, which may lead to anemia, as I mentioned it earlier, class. Incubation period naman, class, is 1 to 2 weeks. So, ito yung mga na-mention ko kanina. Describe ko na lang, class. Transient aplastic anemia may complicate chronic hemolytic anemia, sickle cell disease, thalassemias, and acquired hemolytic anemia in adults. And of course, after bone marrow transplantation, and then symptoms include abrupt cessation of red blood cell synthesis in bone marrow, reflected in the absence of erythroid precursors, accompanied by rapid worsening of anemia. So therefore, class, you need to be careful with parvovirus B19 because the virus targets the precursor cells. Pure red cell aplasia naman, class, your parvovirus B19 may persist and cause chronic suppression of your bone marrow and chronic anemia in immunocompromised patient. For severe anemia, patient depends on blood transfusion. Observe in patient with AIDS, acute immunodeficiency syndrome, malignancies, organ transplant, and congenital deficiencies. So ito yung na-mention ko kanina, class, that's your hydrops fetalis, okay, infection during pregnancy, post-serious risk fetus due to severe anemia, class. Okay, fetal death occurs during pregnancy. Ayan. Sorry, class, with the picture. Okay, which is very common with your Neisseria gonorrhoeae also, class. Pwede ding Listeria monocytogenes kung sa bacteria, class. Fungi, wala masyado. Virus, ito, isa. You have your parvovirus B19. For laboratory diagnosis, we can use PCR, which is the most sensitive. We'll discuss the principle of this one pagdating natin sa molecular biology natin na subject class. Serology, detection of B19 IgM antibodies for recent infection. Then we also have B19 IgG, which persists through years. So it means, class, if you're infected already with B19, pwede ka mag-positive with the B19 IgG test. Culture is not usually done because the virus is difficult to grow. For For epidemiology, widespread, of course, treatment, commercial, IG, immunoglobulin preparation containing neutralizing antibody, and there is no available vaccine yet. For prevention and control, good hygienic practice, hand washing, and not sharing of drinks. So we are done with your DNA viruses class, group number 1 and 2 of your Baltimore's classification. Again, masyadong heavy at saka lengthy yung lecture natin, class. But hopefully that you can still digest the lesson, and if you and I hope that you still supplement the video lecture with your book, specifically your Mayhon, for the preparation of your exam and quizzes, class. And then, ito pala, class, is the characteristic of your pox virus. So if you can observe that one, okay, under your electron microscope. So we're done with your group 1 and group 2. Next week, we'll discuss your group 3 and group 4, which is your RNA viruses. So if you have some questions, don't hesitate to beat me up for your clarifications and or gray areas under your group 1 and group 2 DNA viruses. じゃあまた来週。お疲れ様です。